This video will introduce you to some important information about the medication you're about to start called Warfarin, also referred to as Coumadin. We will go through a lot of new information, but don't worry if you can't remember it all right away. You will be provided with a booklet you can take home with you. What is Warfarin?
Warfarin is an anticoagulant medication. Anticoagulation is a big word that can be broken into simple terms. Anti, meaning against, and coagulation, meaning clots. Some people may say warfarin is a blood thinner, but this is not completely true. Warfarin treats and prevents blood clots by not letting your body make certain clotting factors, so it doesn't actually make the blood thinner.
Tell me more about these clotting factors.
Well, clotting factors are proteins in your blood that help form clots. Clots are useful when you get a cut because they help stop the bleeding, just like you can see in the picture. Clotting factors are made by your liver with help from vitamin K. Warfarin blocks vitamin K. This will make it harder for your body to make a clot.
But I thought you said clotting factors are useful.
They are useful, but in some circumstances they can be harmful. Less clotting factors means your body is less likely to form harmful clots in your blood vessels or heart. Clots that are already there are less likely to get bigger. And clots are also less likely to break off and travel to your heart, lungs, or brain, which can cause further illness.
What is warfarin used for?
Some medical conditions and surgeries can make it more likely that you will get blood clots inside your blood vessels. In addition, warfarin can be used following a severe clot, such as a deep vein thrombosis or a pulmonary embolism. Other medical conditions warfarin can be used for include atrial fibrillation, ventricular dysfunction, heart attack, heart valve replacement, stroke or transient ischemic attack, and following knee or hip replacement or other such surgeries.
So, how long do you have to take warfarin?
It depends.
On what?
It depends on the type of medical condition and what you are using warfarin for. Your healthcare provider will decide the most appropriate length of time for your specific situation. For example, if you have a heart attack, you may need to be on warfarin for a minimum of 3 months.
How do you take warfarin?
Warfarin is a special medication in that it requires lab monitoring to find your optimal dose. It is taken orally once a day. Some things to remember are that you can take it with or without food. Dose changes can occur frequently, so make sure to write your dose on a calendar and speak with your doctor regularly. If you're planning on traveling, make sure you talk to your healthcare provider. Never stop taking warfarin unless your healthcare provider tells you to.
What should you do if you miss a dose?
If it has been less than 6 hours since your scheduled dosing time, take your warfarin right away. If it has been more than 6 hours, take your regular dose at your regular time on the next day. It is important never to double your dose of warfarin. Remember to tell your doctor if you miss 1 dose so that he can interpret your lab results correctly. If you miss 2 or 3 doses, contact your healthcare provider for advice on what to do.
What kind of lab monitoring is needed?
Lab monitoring is done to ensure that there is a balance between preventing unwanted clots and still allowing regular clots to form. There is a very small difference between a dose of warfarin that is too low and one that is too high. So a blood test called a PT-INR is done to determine the exact dose you need. PT-INR stands for prothrombin time international normalized ratio. It is a blood test that measures how long it takes for your blood to clot. For example, an INR of 2.0 means that it takes twice as long as usual for your blood to clot. Once your INR test is done, your healthcare provider may ask you to change your warfarin dose to optimize your therapy. It would be a good idea to write your new dose and the date of your next INR appointment on a calendar so you do not forget. At the beginning, you may need to go for an INR every few days, but you will have to go less often, up to monthly, once your dose is stable. You will always need to go for INR tests as long as you are taking warfarin.
What is my target INR?
Your ideal INR depends on the medical condition that you have. Most conditions have an INR target range of 2.0 to 3.0. Talk with your healthcare provider to find out your target INR range. An INR that is too high increases your risk of bleeding. An INR that is too low increases your risk of clotting. The best way to avoid these scenarios is to monitor your INR regularly to keep it in the target range.
Will my dose of warfarin ever change?
Yes, a lot of factors change how warfarin works in your body, so dose changes may occur, even once it seems to be stable. Things like being sick, starting new medications, or diet changes may all be reasons to monitor your INR more often.
Why am I on a different dose than others, even though we are both at our target INRs?
Everyone needs different amounts of warfarin to get the same INR levels because each person's body will process warfarin a little differently. Doses can range from 0.5 milligrams all the way to 20 milligrams.
What factors can affect how warfarin works?
As mentioned previously, warfarin stops vitamin K from helping your liver make clotting factors. This means when you eat more foods with vitamin K, you need more warfarin to keep your INR the same. The opposite is also true. Eating less vitamin K will mean you need less warfarin.
What kinds of foods have vitamin K, and do I need to stop eating them?
Food like green leafy vegetables, cauliflower, green fruit, and tuna all contain a lot of vitamin K. You do not need to stop eating these foods, but you need to try to have a consistent number of servings of these foods every week. The best way to do this is to keep track of how much food you eat that is rich in vitamin K for 7 days and then try to eat that same number of servings each week. You should, however, avoid green tea and pistachio nuts. These foods have very high amount of vitamin K and alter your INR results significantly. Talk to your healthcare provider if you plan to change your diet, such as become a vegetarian, so they can monitor your warfarin during the change.
What else can affect my INR?
Alcohol can increase your INR as well as your risk of falls. Both of these scenarios can put you at a higher risk of bleeding. Because of this, you should drink no more than 1 to 2 servings of beer, wine, or liquor per day. Other medication can also affect your warfarin. When you fill new prescriptions or start a new over-the-counter product, herbal or vitamin, always remember to ask your pharmacist, will this medication affect my warfarin? Asking about over-the-counter medications is especially important for pain, fever, cold, and stomach medications. How you are feeling can also affect how warfarin works in your body. Tell your healthcare provider if you have been sick, especially if you have been vomiting or have had diarrhea, so that they can monitor your INR appropriately. Lastly, you should avoid sports where injuries and falls are common. Let your healthcare provider know if you change your exercise program or have a large weight gain or loss.
Are there any side effects with this medication?
The most significant side effect of warfarin is the increased chance of bleeding. Symptoms that you can expect include normal cuts taking longer to stop bleeding, more nosebleeds than usual, easier bruising, bleeding gums when you brush or floss your teeth. You don't need to notify your doctor about these normal side effects of warfarin, but you should mention them at your next regularly scheduled appointment. Tell your doctor right away if you see any other bleeding, like blood in your stool, blood in your urine, bruises in odd places, or if a cut bleeds for longer than 20 minutes. Seek medical attention for any other bleeding or unusual symptoms that concern you. As mentioned before, when your INR is too low, it can increase your risk of clotting.
How would I know if I have a clot?
Depending on what condition you have, clots can form in different places. For example, following a deep vein thrombosis or a pulmonary embolism, you should watch for the same symptoms as the first occurrence. In the case of atrial fibrillation, ventricular dysfunction, heart attack, or heart valve replacement, you should watch for symptoms of a stroke or heart attack. A clot has the potential to cause a stroke, so you need to watch for symptoms of a stroke, such as changes in vision, hearing, or speech, numbness or tingling in the face, arms, or legs, difficulty using your arm or hand, or getting dizzy or fainting. A clot may also cause a heart attack. Although symptoms of a heart attack can be different for everyone, some typical signs include chest pain that radiates to the arm, jaw, or neck. Now that you know a little bit about warfarin, you understand how important it is to tell all your healthcare providers, like dentists, doctors, pharmacists, and nurses, that you are taking warfarin. Consider getting a medical alert bracelet so that in an emergency situation, your healthcare team knows that you are taking warfarin.
Let's review. Warfarin do's.
Do take your warfarin as you were told. Do keep all appointments for lab tests and with your healthcare provider. Do get all your prescriptions filled at the same pharmacy. It is important that the pharmacist has a current list of all your medications. Do check with your healthcare provider before starting or stopping any prescription, non-prescription, or herbal medication. Do maintain consistency in your diet and exercise. Call your healthcare provider if you plan to make big changes or if you are going on vacation. Do call your healthcare provider if you have any signs of bleeding. Do tell all your healthcare providers, including your dentist, that you take warfarin. Do wear a medical alert bracelet or carry a pocket card.
Warfarin don'ts.
Don't double your dose if you miss a day, but make sure to mark it on your calendar. Don't take warfarin if you are pregnant. Don't stop taking warfarin without asking your healthcare provider. Don't drastically change your diet, lifestyle, or activity level without talking to your healthcare provider first. Don't do dangerous activities or participate in contact sports. Don't drink too much alcohol. This presentation has just introduced you to some important information about warfarin. Don't feel overwhelmed. You will be provided with a booklet to take home with you. Thank you for listening, and remember, if you have any questions or concerns, contact your physician, pharmacist, or nurse.